Hello, my name is Curcio. I work in the endoscopy unit of the Mediterranean Institute for Transplantation and Advanced Specialized Therapies in Palermo. I'd like to present our experience with what we call IntraDuctal aspiration, or IDA, as a promising new tissue sampling technique for diagnosis of suspected malignant pancreatobiliary strictures. Brushing is the most frequently used technique, as most biliary strictures detected at TRCP can be brushed without technical difficulty. However, a low cellular adequacy is often blamed for limited sensitivity of brush cytology. While this technique has a specificity of nearly 100%, it has only a modest cancer sensitivity, ranging from 18 to 60% in most published series. In order to improve sensitivity for cancer detection, we try to develop a technique to augment lesion targeting and retrieval of higher quality cytology specimens. 42 patients with biliary stricture and 3 with pancreatic stricture were consecutively enrolled in the study. For each patient, we initially performed standard brushing using a standard brushing catheter. We then removed the brush from a second brushing catheter in order to use the tip as a scraping device. This modified catheter was then advanced over the guide wire and moved back and forth, scraping across the stricture at least 10 times. Both the catheter and the suction line were connected to a specimen trap in order to obtain intraductal aspiration. We found IDA to be feasible and safe. The sample adequacy for cytodiagnosis was superior to standard brushing, with a higher rate of accuracy, sensitivity, and negative predictive value. IDA cellular adequacy was 93% versus 38% for standard brushing. Sensitivity was 90% for IDA and 73% for brushing, with a negative predictive value of 92% for IDA and 67% for brushing. We hope that the clear advantages of this new technique encourage further studies and product development. These preliminary data appear to suggest that IDA may represent a new gold standard for cytodiagnosis at TRCP, but further studies with larger numbers of patients will be necessary.